We're ready to begin. I'm going to count down from 5 and then we will start. The Subcommittee on Civil Rights and Human Services will come to order. Welcome, everyone. I note that a quorum is present. I note for the subcommittee that Ms. Omar of Minnesota is permitted to participate in today's hearing, with the understanding that her questions will come only after all members of the Subcommittee on Civil Rights and Human Services on both sides of the aisle who are present have had an opportunity to question the witnesses. The subcommittee is meeting today to hear testimony on ending child hunger, priorities for child nutrition reauthorization. This is an entirely remote hearing. All microphones will be kept muted as a general rule to avoid unnecessary background noise. Members and witnesses will be responsible for unmuting themselves when they are recognized to speak or when they wish to seek recognition. I also ask that members please identify themselves before they speak. Members should keep their cameras on while in the proceeding. Members shall be considered present in the proceeding when they are visible on camera, and they shall be considered not present when they are not visible on camera. The only exception to this is if they are experiencing technical difficulty and inform the committee staff of such difficulty. If any member experiences technical difficulty during the hearing, you should stay connected on the platform, make sure you are muted, and use your phone to immediately call the committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty or need to step away to vote on the floor, that won't happen today, Ms. Adams or another majority member is hereby authorized to assume the gavel in the chair's absence. This is an entirely remote hearing, and as such, the committee's hearing room is officially closed. Members who choose to sit with their individual devices in the hearing room must wear headphones to avoid feedback, echoes, and distortion resulting from more than one person on the software platform sitting in the same room. Members are also expected to adhere to social distancing and safe health guidelines, including the use of masks, hand sanitizer, and wiping down their areas both before and after their presence in the hearing room. To ensure that the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's field timer. The field timer will appear in its own thumbnail picture and will be named 001 timer. There will be no 1-minute warning. The field timer will show a blinking light when time is up. Members and witnesses are asked to wrap up promptly when their time has expired. Although a roll call is not necessary to establish a quorum in official proceedings conducted remotely or with remote participation, the committee has made it a practice when there is an official proceeding with remote participation for the clerk to call the roll to help make clear who is present at the start of the proceeding. Members should say their names before announcing they are present, and this helps the clerk and also helps those watching the platform and the live stream who may experience a few seconds delay. At this time, I will ask the clerk to call the roll.
Chair Bonamici.
Chair Bonamici is present.
Ms. Adams.
Has been working on this for 4 years. You recall many of you being among them.
Mrs. Hayes.
Mrs. Hayes is present.
Ms. Ledger Fernandez. Mr. Mervan.
Mr. Mervan is present.
Mr. Bowman. Mr. Mfume. Chairman Scott.
Chairman Scott is present.
Ranking Member Fulcher. Mr. Thompson. Mrs. McLean. Mrs. Sparks. Mr. Fitzgerald.
Here.
Ranking Member Fox.
Fox is present.
Chair Bonamici, that concludes the roll call.
Thank you very much. Pursuant to Committee Rule 8C, opening statements are limited to the chair and ranking member. This allows for us to hear from our witnesses sooner and provides all members with adequate time to ask questions. And I recognize myself for an opening statement. Our hearing today is to examine legislative solutions to end child hunger and discuss how we can bolster proven strategies to feed hungry children. As elected leaders, one of our most basic responsibilities is to make sure that children have enough to eat. Consistent access to nutritious food is a moral imperative and an economic necessity. It is a good investment because it allows children to live healthier and more fulfilling lives, and it provides the next generation with a strong foundation to grow and thrive. Sadly, child hunger remains a national crisis, particularly in the aftermath of COVID-19. Last July, an estimated 14 million children were not getting enough to eat. The families who were already food insecure before the pandemic, disproportionately families of color, fared even worse. In response, this committee took swift action to prevent millions of children from going hungry. We provided critical flexibility through bipartisan legislation to allow schools to offer free meals for all children and have food delivered to families. We created the highly effective pandemic Ebt program, or PEBT, which lifted at least 2.7 million children out of hunger in its early weeks of implementation. And we eliminated other barriers to getting healthy foods into the mouths and bellies of hungry children. Because of these provisions, as well as the American Rescue Plan, reports of food shortages among households with children fell by 42% from January through April. Although food insecurity has fallen, we know our work is far from over. Our bipartisan commitment to feeding hungry children must be ongoing and unwavering, and must meet the needs in our schools and our communities. It should not matter if the economy is booming or if we're fighting a once-in-a-lifetime pandemic. In the United States of America, no child should go hungry. Today, we will focus on the steps we must take to make that aspiration a reality, specifically reauthorizing federal child nutrition programs, which have not been updated in more than a decade, as well as passing the American Families Plan and American Jobs Plan, which invest more than $40 billion to provide nutritious meals for children in our communities. Through these legislative efforts, we have an opportunity to learn from the pandemic and rethink our child nutrition programs to provide every child with the healthy food they need to succeed in school and then throughout life. The American Families Plan would provide for more than 9 million additional children access to free meals and simplify and streamline program administration by expanding the popular and effective community eligibility provision, or CEP. To best serve children, school meals must also follow nutrition standards that are based on research and science. A 2020 study shows the standards in our Healthy, Hungry-Free Kids Act correlate to a 47% lower rate of childhood obesity for low-income students. The improvements to nutrition standards have made school meals the best source of nutrition for many children, but we must make sure these standards are fully implemented. Both the American Families Plan and American Jobs Plan invest in incentivizing healthier school meals and updating school kitchens. Providing nutrition support after school and during the summer is also critical as students recover from a year of lost classroom time. For example, the American Families Plan makes permanent and nationwide the summer EBT program, which already provides food assistance to some families during the summer. This program gave more than 70,000 children in Oregon access to meals when school was out. By reauthorizing school nutrition programs, we can also strengthen the summer food service program, which serves meals at schools and other community spaces during the summer. During the pandemic, Congress provided the Department of Agriculture with the authority to operate this program throughout the country. Now we have the chance to make these flexibilities permanent because we know hungry kids do not just reside in our poorest neighborhoods. Today, we will examine these solutions and discuss how we can work together to provide all children with the nutritious food they need year-round. I look forward to hearing from our expert witnesses today, and I now yield to the ranking member, Mr. Fitzgerald, for his opening statement.
Thank you, Chairwoman Bonamici, and thank you for calling this hearing on child nutrition. The past year has shown us that school is not only a place where children go to learn. When students switched to virtual learning overnight, we witnessed the real active role hunger can play in schools as well. The harsh reality is many children depend on in-person learning for a reliable meal every day. As we begin discussions on the reauthorization of the child nutrition laws, I'd like to keep that in perspective. Hunger is a verb, and it can affect the entire trajectory of a child's life. Children experiencing hunger perform worse academically. 46% of students from low-income families say that hunger negatively impacts their academic performance, and studies substantiate that claim. Families dealing with hunger are more likely to have a child with lower math scores or repeat a grade. And while studies and data are important in constructing good policy, it does not take a scientist to know that children thrive when they have access to nutritious meals. We also know that schools are more than just places to learn. The pandemic and related school closures highlighted the important roles schools play in helping all children, particularly those from low-income families, establish a routine and escape any stressors that await them at home. That is why when school closures threaten children's access to healthy meals during the academic year, the federal government worked in a bipartisan manner to ensure that school-age children continued to receive this vital resource. This was the right decision in an emergency, and it was encouraging to see everyone work together in this time of need. But as the pandemic winds down and schools now reopen, we too must shift our attention away from heavy-handed federal intervention and towards supporting local school districts as they work to administer and, in many cases, essentially restart their school meal programs. Any reauthorization of the child nutrition laws must involve local school officials and private partners because they know best what their students need and are positioned to deliver healthy meals in an effective manner. That means establishing rules that are easy for schools to follow and allowing them to serve meals that students will eat. It also means addressing the current standards in place and making the needed reforms so that kids will in fact eat their healthy meals. Though some of these reasonable reforms we can work with our partners to create, also we must make sure that school lunches are not wasted. For example, we can help more children get the benefits of milk if we apply a little common sense and allow schools to serve low-fat flavored milk with their meal, or ensure that sodium limits don't prohibit serving cheese at lunch. Spoken from the Congressman from Wisconsin. Similarly, we must refrain from creating new duplicative programs and instead focus on improving existing programs to better serve students most in need, especially those in rural communities. I hope we can all work together and make some good changes to programs like the Summer Food Service Program, Farm to School, and other existing programs to address the gaps in service that exist before we just layer on a new set of programs. I am hopeful that as we keep these priorities in mind, providing healthy meals that students will eat, allowing wholesome foods like cheese to remain on students' plates, and reforming existing programs to address gaps in coverage, that we can arrive at a bipartisan solution that puts students, not politics, at the forefront. Thank you to all the witnesses for taking time out of your day to discuss this important issue, and I look forward to hearing from you all, and I would yield back.
Thank you very much, Ranking Member. Without objection, all other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on June 24th, 2021. I will now introduce the witnesses. First, Michael J. Wilson. He joined Maryland Hunger Solutions in July of 2013 as director. Mr. Wilson is a core advisor in the Maryland Partnership to End Childhood Hunger and previously served on the board of the Food Research and Action Center, or FRAC. Next, we have Crystal Cooper, who is the Executive Director of Nutrition Support Services for Chicago Public Schools, which serves 330,000 students at 660 schools. Ms. Cooper also serves as the treasurer for the Urban School Food Alliance. Brandon Lips is with us. He's the co-founder and principal of Caprock Strategies, a strategic consulting firm specializing in food, agriculture, and anti-poverty programs. Prior to launching Caprock Strategies, he served in the role of Undersecretary for Food Nutrition and Consumer Services at the U.S. Department of Agriculture. Next, Tom Colicchio is the chef and owner of Crafted Hospitality, which includes restaurants in New York, Los Angeles, and Las Vegas, and he serves on the boards of Children of Bellevue, the Independent Restaurant Coalition, City Harvest, and Wholesome Wave. Chef Colicchio is also the head judge and executive producer of the Emmy Award-winning Bravo TV hit series, Top Chef, which we were happy to welcome to Portland. Mr. Colicchio executive produced the 2013 documentary, A Place at the Table, about the underlying causes of hunger in the United States. We appreciate all the witnesses for participating today and look forward to your testimony. Let me remind the witnesses that we have read your written statements and they will appear in full in the hearing record. Pursuant to Committee Rule 8D and committee practice, each of you is asked to limit your oral presentation to a 5-minute summary of your written statement. Before you begin your testimony, please remember to unmute your microphone. And during your testimony, staff will be keeping track of time and a light will blink when time is up. Please be attentive to the time and wrap up when your time is over and remute your microphone. If any of you do experience technical difficulty during your testimony or later in the hearing, please stay connected if you can on the platform, make sure you're muted, and use your phone to call the committee's IT director whose number was provided to you in advance. We will let all the witnesses make their presentations before we move to member questions. When answering a question, please remember to unmute your microphone. The witnesses are aware of their responsibility to provide accurate information to the subcommittee, and therefore we will proceed with their testimony. I first recognize Mr. Wilson for 5 minutes.
Good afternoon, good morning, members of the committee. My name is Michael J. Wilson. I'm the Director of Maryland Hunger Solutions, and I'm also representing the Food Research and Action Center. Thank you, Chair Bonamici, Ranking Member Fitzgerald, Ranking Member Fox, and Chairman Scott for allowing me the privilege of being able to be with you today. As millions of children and families recover from the health, educational, and economic impact of the pandemic, there's never been a more important time to make significant investments in the child nutrition programs. The upcoming child nutrition reauthorization process and economic recovery legislation present the opportunity for the committee to make much needed improvements to the child nutrition programs to reduce childhood hunger, decrease childhood overweight and obesity, improve child nutrition and wellness, enhance child development and school readiness, and support academic achievement. We need to expand program access and participation, ensure nutrition quality, and simplify program administration and operation. As the committee that oversees the child nutrition programs and education, you have a historic opportunity to make a significant investments and improvements to the child nutrition programs in a way that would allow them to better combat hunger and improve health while supporting academic achievement and educational outcomes. My testimony will focus on investments in the child nutrition programs. I want to ensure that you know that we believe that the most important step that the committee and Congress can take to support health and education is to allow all schools to offer school meals to all children at no charge, which is what we are doing right now. My testimony provides detailed information on why this is a critical component of a 21st century education system. Millions of children currently are eligible for free and reduced price meals who are certified don't participate because of administrative hurdles, conflicting government bureaucracies, stigma, and many other barriers. There are incremental steps that can be taken to improve our systems, but the most efficient and effective way is providing healthy school meals for all. Let me tell you a little bit from my perspective here in Maryland, which I think is emblematic around the country. Number one, school breakfast is a game changer. We know that often schools make sure kids have a healthy breakfast when they are testing, but we need to make sure that those kids have a healthy breakfast every day. We use a program here in Maryland, which many of my colleagues around the country are jealous of, called Maryland Meals for Achievement. We're not completely funding it, but it makes sure that low-income kids can get breakfast in the classroom, which is a critical component of how we succeed. Number two, school meal debts damage children in many ways. And I want to be very specific that children are moving through school, graduating from school with school meal debts that they build up because they are charged and they can't pay for those school meals. I'm going to give you a specific example. There was a girl, second grader in Baltimore County, just outside of Baltimore City. And her mom was wondering, why is my daughter constipated? Why is she so hungry when I pick her up at the end of the day at school? Why is this happening? Only to find out that her daughter had been getting a lunch when she goes to school and having the lunch thrown away and be giving a cheese sandwich. The daughter should not have had that happen to her because her mom was on SNAP. She was eligible for free meals. But the lack of communication between the school system, and the parent made the daughter have to suffer. There's no way you can ever say you're sorry to that 7-year-old girl who now has to live with this all of her life. There's no way of making this up. And it's another reason why we need to have school meals for all so that we aren't damaging young children this way. Third, community eligibility is a win-win for schools and students. It's been great for us in urban Baltimore. It's been great in suburban Howard County, which is one of the wealthiest counties in the country, $84,000 of household income, where even they are using community eligibility. And in Somerset County, in Eastern Shore, where the superintendent has said it's the best decision he ever made as an educator. Children learn in school. They don't just learn reading, writing, and arithmetic. They learn about history, computers, and our government. They need to learn from all the work that we are doing and that you are doing is that they are our most valued resource and that they are our future. We should invest in them by making sure they get free school meals for all students. Thank you, Madam Chair.
Thank you for your testimony. Next, we'll hear from Ms. Cooper. Ms. Cooper, you're recognized for 5 minutes for your testimony. Welcome.
Good afternoon, Chair Bonamici, Ranking Member Fitzgerald, Chairman Scott, Ranking Member Fox, and members of the Subcommittee on Civil Rights and Human Services. Thank you for the opportunity to discuss ending child hunger, priorities for child nutrition reauthorization. I am Crystal Cooper, Executive Director of Nutrition Support Services at Chicago Public Schools. I've had the honor of working with some of the best nutrition professionals in Chicago for over 7 years. The lunchroom staff at CPS serves over 60 million meals to over 300,000 students annually. CPS is a 100% community eligibility provision district receiving the maximum free reimbursement rate for all meals. CPS participates in all child nutrition programs available, such as the National School Lunch Program, the School Breakfast Program, Child and Adult Care Food Program, the Fresh Fruit and Vegetable Program, the Department of Defense Fresh Fruit and Vegetable Program, and the Summer Food Service Program. We are committed to serving our students the freshest and healthiest meals during the school day and during after school and Saturday activities. During the pandemic, we have been grateful for the waivers received, specifically the non-congregate feeding waiver and the waiver allowing districts to run the Summer Food Service Program. We have served over 45 million meals with these waivers and started meal deliveries to homes of students or families that are most impacted by COVID-19 and cannot get to a food distribution site. We are a founding member of the Urban School Food Alliance that comprises 15 school districts. Through monthly membership calls, we share recipes, ideas about farm to school programs, and best practices regarding procurement, meal distribution, meal kits, summer feeding, and food trucks to ensure we are all providing healthy and nutritious meals to students. At Chicago Public Schools, we ensure all menu items meet the Target 2 standards for sodium reduction, and all grains are 100% whole grain rich, composed of 50% or more whole grains. We did not and do not intend to use the waivers for flexibility on these standards. We have maintained our commitment to serving fresh local food from the Midwest, including frozen local produce once per week and local no antibiotic chicken twice per month. We are targeting removing ingredients of concern from food, which include added sugars and items that students cannot pronounce. We believe that educating students about food and food choices is key to the success of child nutrition programs. If menu items are not favorable with students, we work with local chefs to develop new recipes and hold student focus groups and menu tastings to determine items to replace. As an African-American woman, a graduate of Chicago Public Schools, and a recipient of the School Breakfast and Lunch Program, I see my role as being an advocate for my younger self. This means ensuring students don't grow up believing it is normal to have high blood pressure, diabetes, or to suffer from obesity. As a school nutrition professional, if I can introduce students to items that are colorful, fresh, crunchy, and flavorful, and have them as repeat customers, I'm going to fight for that daily. It is my responsibility to remove the hunger barrier and make sure students receive the nutrition they need to function at their best and focus on academics. This also means ensuring students are not denied a healthy school breakfast or lunch due to stigma or financial concerns. It means maintaining a high bar for nutrition standards. As a committee, you can have a profound effect on these efforts. I urge you to reject the idea of rolling back nutrition standards that help improve student health and shape their lifelong preferences. At CPS, we have had no problem with finding many items and recipes that our students enjoy. I also urge you to support healthy school meals for all to ensure every student has access to free nutritious meals, and to also ensure nutrition professionals can focus on the best interests of their students rather than processing paperwork, determining which students are eligible for meal assistance, and collecting debt. But the impact of high nutrition standards and healthy school meals for all will be minimized if our students are not guaranteed sufficient time to eat their food. Our principals are often put in the position of squeezing in 20-minute lunch periods, leaving students maybe 10 minutes to eat their meals after accounting for the time they waited in line. The American Academy of Pediatrics recommends that students get at least 20 minutes to eat lunch, and I urge the committee to consider policies that support sufficient lunch times to allow students time to eat their food. I would like to end by thanking you for this time today, as I advocate for all students in Chicago Public Schools and the hardworking, dedicated staff who show up daily to ensure our students receive balanced, nutritious meals. Thank you.
Thank you so much, Ms. Cooper. Next, I'll recognize Mr. Lips. Mr. Lips, you have 5 minutes for your testimony. You need to unmute there, Mr. Lips.
Sorry about that. Thank you, Chairwoman Bonamici, Representative Fitzgerald, and members of the committee for the opportunity to discuss the lessons learned from my time leading the Food and Nutrition Service at the U.S. Department of Agriculture. I am Brandon Lips, a principal at Caprock Strategies, where I work to connect stakeholders across sectors to solve big problems so that regular people can thrive. At USDA, I committed early on to hearing directly from the families that we served and those that serve them. These partners confirmed that real change happens when we meet families where they are and empower them to take the next step, a concept that we called moving families forward. As you consider child nutrition reauthorization, I implore you to remember the vast diversity of our country and the resources available to each child nutrition professional. There really is no one-size-fits-all approach. The Healthy Hunger-Free Kids Act significantly increased consumption of fruits, vegetables, and whole grains, and decreased overall calories and sodium in our school meals. This is an exciting accomplishment that we should all celebrate. But overly restrictive regulations made many school meals less palatable, so kids are less likely to reach for nutrient-dense options like milk. Even considering significant increases in automatic enrollment, school lunch participation has declined by more than 2 million students per day. Those who serve our children are deeply committed to serving nutritionally rich meals that keep kids healthy. They also need to be able to serve nutrient-dense meals that children will eat. While at USDA, I visited dozens of schools, some served by trained chefs. Over and over, I saw children trading toys for food that other kids brought from home, and some dumping their lunch trays in the trash bin mostly full. My site visits confirmed what USDA's research shows. Over 30% of school food is still wasted. 1/4 of vitamins A, C, D, calcium, and potassium are dumped in the trash. USDA's current regulations are based on the best available science of the perfect meal, but the science is worthless if the children don't eat the food. Congress should maintain and celebrate the important nutritional advancements schools have made, but policy must also be informed by local nutrition professionals who know their children and are asking for minimal flexibilities in the dairy, sodium, and whole grain categories so they can prepare tasty and nutritious meals. Similarly, child nutrition providers consistently ask for simpler program regulations so they can spend more time with the children they serve. Many providers serve meals through multiple programs that require redundant applications and reporting. Please consider streamlining and simplifying these program requirements while maintaining program integrity. As we enter the summer months, it's the perfect time to consider options for summer food service. Congress should authorize a full toolbox of summer food service options that empower local providers to choose the option that best serves their own communities. Only about 15% of eligible low-income children access the summer food service program, in part because so many lack transportation to reach a congregate feeding site. The pandemic provided an opportunity to test several solutions on a large scale, and a number of options have proven very valuable, including pandemic EBT and bus routes. One such example is a public-private partnership between the USDA, the Baylor Collaborative on Hunger and Poverty, McLean Global, and PepsiCo's Food for Good that quickly delivered almost 40 million nutritious meals to verified low-income children in 43 states when children were furloughed from school. Options like Meals to You ensure that the summer program does its job of meeting families where they are, delivering USDA-approved nutrition to the doorsteps of rural and other hard-to-reach children. Policymakers must allow schools to meet our children's needs and teach nutrition in ways that empower kids to make healthy choices. In one of my local visits to a school farm, a bright young student told me that her farm-to-school program inspired her to aim for college, majoring in biology. Later that same day, I saw students in the lunch line select and then eat fruits and leafy greens vegetables. Change always happens in community. For these kids, change happened in their community garden. Investing in hands-on learning improves nutrition in ways that complicated regulations never will. In closing, I want to thank the committee for your engagement on this important issue. And as you advance, I urge you to consider how programs can change kids' lives and community and be a tool of empowerment to move families forward. Thank you.
Thank you, Mr. Lips. And now we will hear from Chef Colicchio. Chef Colicchio, you're recognized for 5 minutes for your testimony.
Thank you. Chairman Scott and Ranking Member Fox, Chairman Bonamici, Ranking Member Fitzgerald, and members of the House Education and Labor Committee. Now, I was here 12 years ago to testify in front of this very committee, then chaired by Representative George Miller, in support of what became the Healthy Hunger-Free Kids Act, a law that addressed the rising epidemic of childhood obesity in America by approving nutrition of school meals. The law reduced sugar and sodium, added fresh produce and whole grains, while also removing vending machines peddling sugary soft drinks from school lunchrooms. At the time, the bill's opponents criticized the bill as a dangerous overreach, painting it as the work of the nanny state bureaucracy. Well, for the record, I date back to the days when kids walked home for lunch and where my nanny, my grandmother Esther, always had a hot meal waiting for me and my brothers. And I only wish that all American school children could have that same experience. In the years since President Obama signed the Healthy Hunger-Free Kids Act into law, and despite the fact that obesity rates began to drop, certain members of Congress have chipped away at the standards that the law created. They've added sugars back in and gotten rid of the mandate for whole grains, citing concerns about food waste. Well, much has changed in the past 12 years, but much remains the same. A healthy diet is still out of reach for many Americans, meaning that their children's health is linked to the quality of food they receive in school. So I'm here today to urge you to find the funds and the political will to do right by these kids. As millions of children and their families recover from the impact of the COVID-19 pandemic, there has never been a more important time to make significant investments in the childhood nutrition programs. My mother, Beverly Colicchio, was a school lunch lady. She worked for decades as a cafeteria supervisor in Elizabeth, New Jersey, where about 70% of the students qualified for free or reduced price breakfast and lunch. And often the meals that she served to those kids were the only food they got all day. And it was upsetting to her that the cheapest food contracted out to the lowest bidder was usually what was on the menu. Food that may have met the nutritional guidelines on paper without being truly healthy. And her experience feeding these kids stayed with me for a lifetime and impacts everything that I do. And so when COVID-19 shut down our economy, I immediately thought of the 30 million public school children, like the ones in my mother's lunchroom. Where were they going to eat now that these schools were shut down? Well, thanks to the hard work of advocates and some of the members on this call in New York and nationally, regulations were eased and temporary provisions were made to allow for programs like the pandemic EBT, which was a lifeline for families who cannot access school breakfast and lunch while schools were shuttered. Now is not the time to roll back this critical support. Now, I'm glad that the administration would like to make the summer EBT program permanent and hope this committee will support legislation HR 3519, the Stop Child Hunger Act of 2021, that would provide families with an EBT card whenever schools are shuttered. And also Chairman Bonamici's Access to Healthy Foods for Young Children Act, which provides funding for meals at extended daycares and after-school settings. We can continue to make life easier, not harder, for families to recover from this year's profound disruption by expanding direct certification and community eligibility provisions to eliminate redundant paperwork for schools and families. Now, if I were a member of Congress, I would introduce, in my mother's honor, the Beverly Colicchio School Nutrition Act for all, which would make school free meal for all public school children across the country, eliminating the belabored three-tiered eligibility system that siphons critical funds from the plate to the administrative costs. And this leaves kids vulnerable to shaming. The days of pulling a kid out of a hot food line in front of his peers to hand him or her a cold cheese sandwich would be over. I would also mandate that a percentage of all foods in the school nutrition system be supplied by local farms, providing markets for farmers growing fruits and vegetables. It would allow for a regional system of food hubs where this healthy food will be processed, frozen, and shipped for use in the school system, creating a wealth of new jobs. I would go back to scratch cooking, providing hundreds of thousands of good-paying union jobs and taking the contracts back from the no-bid corporate players who lowball their way into school budgets with trays of no-cook, dehydrated, processed, unhealthy food that doesn't require cooking skills or even a kitchen to prepare. I would also use our lunchrooms as a living classroom to teach nutrition to kids at an early age. You know, we teach our kids math and literacy from their youngest days, igniting their curiosity and allowing these skills to build and grow over a lifetime. And we should be doing the same with health, nutrition, and cooking too. There could be no better investment, no better stimulus to our economy than millions of thriving children. It will translate into vast savings in healthcare costs down the line and help millions of kids grow and develop as they should into a population of robust, productive adults fit to lead, fit to serve our country, and to help us compete in the global economy. Thank you for the opportunity to testify in front of this committee. I welcome your questions. Thank you.
Thank you for your testimony. Under Committee Rule 9A, we will now question the witnesses under the 5-minute rule. So I'll be recognizing subcommittee members in seniority order, again, to ensure the members' 5-minute rule is adhered to. Staff will be keeping track of time and the timer will show the blinking light when time has expired. Please be attentive to the time, wrap up when your time is over, and remute your microphone. Please note that after the first round of questions is completed, the majority and minority have agreed to a second round of questions for the chair and ranking member or the ranking member's designee. As chair, I now recognize myself for 5 minutes. I'm going to start first addressing a tough issue. In an interview with committee staff, a mother talked about how during the COVID-19 pandemic, she had fought for her school district to bring an emergency summer food service site to her neighborhood, which is home to primarily Black children. Just days after the site opened, the school district abruptly stopped distributing fresh meals and switched to the Trump administration's Meals to You program, which I know, Mr. Lipp, you mentioned. She then waited weeks for the first box to arrive, and when the boxes started coming, she received low quality or even spoiled food. So I'm going to ask you, Mr. Lips, where did that the administration, the Trump administration's implementation of the Meals to You program go wrong? And how can we make sure that no parent in the country with hungry kids ever has to wonder when assistance will arrive and whether it will be edible when it does?
Thanks for that question, Chairwoman Bonamici. I'm not aware of that situation. It was not brought to my attention at the time. It sounds like maybe the school made a premature decision to stop their local service, or maybe they didn't have the volunteers willing to get out during the pandemic. I know that was a problem in a lot of places, and that's why we were very proud in this partnership to be able to deliver those 40 million meals to 270,000 kids across 43 states, mostly in rural areas where kids were never served with summer sites to begin with. And really, That's what I was talking about today, is there's a suite of options, and schools need to be making the right decision about which program needs to be serving their children in the best manner. For those kids who can get to a congregate site, you're never going to hear me argue that that shouldn't happen. At most congregate sites, they're providing some type of fellowship among kids, some type of education. I am for those things. For rural kids in areas like I grew up in, who have never, the 85% of kids in this country who have never been served by summer, I think that the committee needs to continue to look at wonderful options that can serve them. And certainly in any program, mistakes happen, and hopefully they're quickly remedied. This must be a rare problem. It never came to my attention while I was there, but
I don't want to cut you off, but I
appreciate
really, I want to get
Okay.
to another question. Thank you for
Sure.
your acknowledgement that there was an issue there. Mr. Wilson, in the Healthy, Hungry, Free Kids Act, Congress established the Community Eligibility Program to allow high poverty schools to serve free school meals to all children. And unfortunately, we know that about 30% of eligible schools have not adopted CEP, and that the low reimbursement is a barrier for many schools. So President Biden's American Families Plan calls for increasing the multiplier used for school reimbursement rates. So will you please discuss how increasing the CEP multiplier will help increase access to free school meals, and how does expanded access reduce stigmatization and improve students' health?
Yeah, so thank you very much for that question. We know that in Maryland, we know that community eligibility has been a real win. I think one of the things that we hope to be able to move forward on this is that by changing those calculators to better capture kids who are actually experiencing poverty. We have never in the history of this country done a perfect measure of poverty, but we're much better today than we were before. And so using the direct certification methods and community eligibility, using kids who are using SNAP, TANF, if we can add Medicaid, that will mean so much. If we can deal with these numbers in a realistic way, we're going to have a much better, much more accurate picture of poverty. And that's going to help kids in rural schools, in suburban schools, and in urban schools. We're going to capture all of those kids who are in poverty.
And Mr. Wilson, can you talk a little bit about how the multiplier works and what a difference it would make to increase it?
Oh, absolutely. We've seen schools that were almost eligible for CEP, and school officials and food and nutrition directors have a hard time making the decision to use it, because those programs have to run in a virtually a revenue neutral method. They can't lose money. And so they are often dealt with the Hobson's choice of, do I lose money, or do I feed these kids? And as Ms. Cooper said, they all want to feed the kids. If we can give them the tools, the accurate tools to be able to feed those kids and to utilize community eligibility, we're going to make a much bigger impact in their lives right now.
Thank you. And more time spent feeding hungry children and less time spent on administrative paperwork.
Oh, absolutely. I mean, in every place in Maryland where we've done it, they've been relieved to not have to do paperwork and chase down kids and parents to just get forms, to get the free and reduced meal application forms.
Thank you. And we've heard a lot of criticism today of some criticism today of the 2012 nutrition standards. And I request unanimous consent to enter into the hearing record a study by researchers at Harvard that found that the prevalence of obesity among children in poverty would have been 47% higher in 2018 if those updated standards had not been enacted. And I yield back the balance of my time, which has expired, and I now recognize the Ranking Member Fitzgerald, for 5 minutes for the purpose of questioning the witnesses.
Thank you, Madam Chair. Mr. Lips, as a representative, like I said earlier, of Wisconsin, America's Dairyland, I can tell you that unrealistic limits on sodium have impacted entire meals and many of the components of those meals. That can lead to students losing access to, obviously, one of the important food groups. Was one of the reasons that Secretary Perdue pursued updating the regulations, was that related to the sodium standards? And then what about the regulations for milk and whole grains? And finally, what were the Secretary's reasons for updating the regulations related to these, if you can recall?
Sure, Representative Fitzgerald. Secretary Perdue put forward his intent to update those even prior to my arrival at USDA. And he always said that that was based on his input on the ground from local school providers about what kids would eat. And certainly you hear from folks in the cheese industry about the difficulties in making a cheese that's properly preserved and that's edible and that works in the various different products. And we know there's challenges in that. And I know that manufacturers across the board are working on products that will move along the spectrum to meet all these requirements. And I'm a firm believer that over time they will get there. But we heard time and again that they're not there. And it's important, particularly when you look at the dairy category in the dietary guidelines, which was affirmed in the most recent dietary guidelines. It is a nutrient-dense food that children across this country eat in various different forms at their local level. And it's extremely important that they're consuming the dairy items put on their tray and not putting them in the trash, so they're not part of those 25% of nutrients that end up in the trash can. And that was really the motivation behind that. As you know, Congress, over time, since the inception of the Healthy Hunger Free Kids Act, has provided flexibilities on sodium whole grains and dairy in different respects. And schools have not fully implemented those across the board at this time.
Very good. Very good. Thank you. And then can you also comment on the challenges in trying to meet the meal pattern standards?
Sure, Ranking Member Fitzgerald, and a lot of that is very similar to this. The meal patterns are relatively complicated, and certainly if you look at the different resources across schools, some are very well resourced to be able to deal with that, some are not, and they ended up having menus that are rotated over and over and over, not giving the kids a lot of choice. There's a wonderful team at the Food and Nutrition Service, the Institute on Child Nutrition, who help with these. But as you look at making these stricter over time, it makes that an ever more complicated requirement. And in often cases, kids are served foods that are not familiar to them. Folks in the lunchroom don't have time to talk to them about that and help them along, as some of my colleagues at the table today have talked about. And so it just becomes very complicated for those folks who are trying to do the best for the children they serve every day.
Thank you very much. I yield back. Thank you.
Sure, thank you.
Ranking Member Fitzgerald. And next I recognize Dr. Adams. Representative Adams, you're recognized for 5 minutes for your questions.
Thank you, Chairwoman Bonamici and Ranking Member Fulcher for hosting today's hearing. And thank you to our witnesses for your testimony. Prior to the pandemic, food insecurity was a pressing problem for our nation. During the pandemic, food insecurity has been exacerbated and children across America continue to suffer. Today's witnesses have shed further light on the devastating consequences that children experience when they cannot access nutritious meals. The Healthy Hunger Free Act set a process for evidence-based federal standards for food served throughout the school day. A University of Washington study revealed that since the healthier standards have been in place, the nutritional quality of the foods chosen by students increased by 29%. A Harvard study showed that children are now eating 16% more vegetables and 23% more fruits at lunch. So, Chief Colicchio, what strategies can schools use to incorporate fruits, vegetables, whole grains, and ingredients with less sodium and sugar into appealing meals for children and adolescents?
Sure. Wellness in the schools here in New York, they do a great job doing just that. They actually encourage chefs to get involved to help out with recipes. You know, I find that, I have a 10-year-old and a 12-year-old, and my 10-year-old is pretty picky. I also garden. And when I take him out to the garden and he sees what's growing, he's more apt to try new things. And so I think it starts with the education. I think it starts with again, part of using the school, the lunchroom as an educational tool. Teach people about nutrition, teach children where their food comes from, how it's grown, the role that farmers play, the role that dairy farmers play, how you make cheese. All these things are really important. I think once kids understand this, they're more apt to try different things. We also know that young palates need to try something at least 12 times before they actually find it palatable. I struggle with my 10-year-old who would prefer to only eat chicken nuggets and and that's just about it. Our pizza, but pizza with no tomato on it, which I don't know if it qualifies for a pizza in a school lunchroom. But you know, he's difficult, but I find education is the key.
Okay, great. Thank you. Many schools began virtual learning during the pandemic, and several schools continue to do so. As a result, children who normally rely on school-provided meals have faced food insecurity and the ensuing negative impacts that food insecurity brings physically and psychologically. So, Ms. Cooper, can you please describe in detail the obstacles that children have faced during the pandemic to obtain nutritious meals?
Thank you, Representative Adams. So when you think about the school day, generally students come through a brick and mortar building, and they are going through a service line and they're getting meals. The challenges they face now during the pandemic was actually physically getting to the site if they didn't have transportation. So what we did actually do was we kept a lot of our sites open because a lot of our schools in Chicago are neighborhood schools. So we have schools that are across the street from homes. So we wanted to make sure that access was available, that if you went north or south, you could find a school site that actually served as a food distribution site, so that students would not have to worry about this. We also work really closely with other city agencies to make sure that all access points to food are available, and that when parents or guardians come to schools, they have other resources. So we have flyers where we say, here, you can go to this actual food bank or pantry. And then we make sure that we really market our hours, and we work with our local aldermen to make sure everyone in the city knows that Chicago Public Schools is open Monday through Friday, 9 to 1, coming in multiple meals for multiple days. Also, if you can't get out, we do meal deliveries. So we have a website that allows families to make sure that they can sign up for that. If there are challenges, again.
Thanks, ma'am. Let me try to get one more question in here. I appreciate it. Mr. Wilson, you mentioned a few recommendations regarding streamlining for this. How will technology help boost the efficiency of nutrition programs both during the school year and in the summer?
So let me try to do this in 20 seconds because I know you don't have much time, which is,
right.
Let's use more modern technology to find which kids are actually experiencing poverty. Let's not do paper-free and reduced meal application forms. Let's see who's on SNAP. Let's see who's on Medicaid. Let's see who's homeless. Let's see all of those. And I want to recognize your SNAP bill as a way to help us grow accurately the SNAP population of people who are actually eligible.
Great, thank you very much. And Madam Chair, I'm going to yield back.
Thank you so much. Next on my list, I have Representative Sparks. I do not see her on the platform, so I'll go to the ranking member of the full committee. Dr. Fox, you're recognized for 5 minutes for your questions.
Good morning to Representative Bonamici. I know it's morning where you are.
Good morning, good afternoon, Dr. Fox.
Okay, good to see you. Mr. Lips, there have been calls for free meals for all students. Do you know how much that would add to the cost of the program?
Ranking Member Fox, I'm sorry, I don't know. I was told when I was at USDA that those numbers are very large, but I was never given an accurate number on that. The current team might be able to.
Could we get that from you? We'll get that later and put it in the record. Mr. Lips, we often focus on the big picture in these programs and fail to look at the pockets of students who may need help. That's especially true for students in rural communities. What are some unique challenges they face in the school meal and summer food programs? And what are some ways we can work to target better those programs to help those in need?
Thanks, Ranking Member Fox. I think if you listen to what the witness said today, there's a lot of commonality about what we talked about. I think if you look at resources, certainly a lot of rural areas lack some of the resources that some of the larger school districts do. Certainly where I grew up in a high poverty area, we had 110 kids from kindergarten to 12th grade. We had 1.5 staff in our lunchroom. And that's obviously much different from some of the folks in these larger urban school districts, and it just varies on their resources. Also, access to fresh and local. There are areas in this country where local is not an option for many types of produce, some not at all. And so we have, as we talk about those things are extremely important, we need to make sure that we have solutions that include all of them. And then, as I talked about in my testimony, Ranking Member Fox, on the summer program, we have such low participation in that program. And we talk a lot about feeding all these children during the school year, and then we send them home for 3 months, many without transportation to a congregate site. Even in town, that's often a problem. And there are a number of organizations across this country with suggestions on that, many that were tested in the summer. And I just encourage you to look at all of those options to empower people on the local level to serve their kids in the best manner possible.
Well, I have visited summer feeding programs in my district on more than one occasion, and I'm very familiar with what you're talking about. Mr. Lips, to have a successful school meal program, we need to ensure the program operates efficiently and effectively to provide meals to students in need. Do you have some recommendation about other reforms we can make in the upcoming reauthorization to improve the program that does not include creating new programs?
Sure, Ranking Member Fox. Certainly reducing administrative burdens across the program. The wonderful team at F&S has created an online meals application that's not been overwhelmingly adopted by schools. As one of the witnesses testified today, a lot of these schools are operating multiple programs. I think there's opportunities both in legislation and regulation to reduce the application and reporting requirements on those. If they're good providers, they're good providers. There's also a lot of work been done on looking at integrity from a risk-based approach instead of an all-across-the-board approach that would reduce the time that folks have to spend on paperwork on the integrity front. So I think there's a lot of options out there. They require some time and effort to get done, but I do believe they're worthwhile because we all know that these folks want to spend more time with the kids.
Great. One more question, Mr. Lips. You raised the issue of food or plate waste in your testimony, and we often hear other people talk about whether it is or is not happening. Can you please explain briefly what that is, how it detracts from what's being served on the plate, and why it's a concern we should all want to tackle?
Sure. Ranking Member Fox, is one of the most important things that we talk about is plate waste. That's when the food is put on the plate, the child sits down with it, doesn't eat it, and it ends up in the trash can. Today's meals are designed to the perfect scientific meal. And if a third of that plate, 25%, a lot of the nutrients is going in the trash can, they're not consuming that perfect scientific meal. And there are a lot of issues that affect that. As the chef talked about, it takes a lot of education and learning with those kids, and that takes time and effort on the local level. We need to make sure that we're empowering folks to do that. I've asked kids why they weren't eating their pear, and they bit it on the table and said it's rock hard. We have to make sure when we're working on fresh that we're doing it right. And when we're serving population that aren't familiar with new foods, that we're serving those in manners that help kids adapt to those instead of just setting them on the tray and expecting them to take them up. I visited a school where black beans were served. Nobody ate them at my table. I asked why, and they said they'd never seen a black bean before. So there's a lot of factors that affect that, and it takes a lot of effort on the local level.
Well, thank you very much, Madam Chair. I bought a pear the other day at the grocery store. It looked beautiful. I got it home and I left it a day or two, and I cut it, and it was so hard and didn't have much taste. I covered it up, and by golly, this morning it tasted great. So your example of a pear being hard and not being very appetizing fit me this week. So I understand exactly what you're saying. Thank you, Madam Chair.
But they can be great.
Go over, but I had a perfect example of that this week. Thank you, Madam Chair. Bye-bye.
Thank you, Dr. Fox. Thank you. I want to make a unanimous consent request. Ms. Cooper's district in Chicago is an excellent example of meeting nutrition standards. So I request unanimous consent to enter into the hearing record the Chicago Public Schools lunch menu that includes cheese on several days and also meets the target 2 for sodium without objection. And next for questions, I recognize Representative Hayes. Representative Hayes, you're recognized for 5 minutes for your questions.
Thank you, Chairwoman Bonamici, and thank you so much to all the witnesses for being here today. We have a tremendous opportunity this Congress to take on child nutrition reauthorization. We can make sure that all children have access to reliable, healthy meals in and out of school. To do that, we must first recognize our shortcomings, which help to fuel this crisis. We have to acknowledge many of the cuts made to many of our most basic nutrition programs over the years, leaving children vulnerable to hunger in the first place. Mr. Lips, during your time as Deputy Undersecretary, USDA proposed a USDA rule entitled Revision of Categorical Eligibility in the Supplemental Nutrition Assistance Program. An analysis conducted by USDA during your tenure found that, and I quote, 684,000 households with children would lose SNAP because of these proposed changes. That same analysis found that potentially as many as 982,000 children would no longer be directly certified for free school meals based on SNAP participation. Mr. Lips, you came before this committee in October 2019 to defend that rule, citing the need to protect and enhance integrity. And from my recollection, I remember you cited some anecdotal incidences of millionaires taking advantage of the SNAP program. So I was very happy today to hear you say that you were concerned that 2 million less children were participating in the program. So my question today is just very simple. I'm happy to hear that you're concerned that 2 million less children are participating, but under the rule, under your leadership, 1 million children would have been thrown off of SNAP. I want to make sure that we are not changing the narrative to make this a conversation just about healthy food choices or cheese and milk. This was about taking food away from hungry children. During this pandemic, under 2 different administrations, we have been able to expand pandemic EBT. I was happy to hear Mr. Wilson talk about my legislation to feed kids during school breaks and whenever they were out to help families have access. We did some tremendous work to close these hunger gaps and pockets of hunger throughout our country during this pandemic. Mr. Lips, has your position on this issue changed in the last year, having seen what you've seen? And if you were still Deputy Undersecretary of FNS today, would your department finalize and implement this rule based on everything we've seen, everything we've heard, and everything that we've done?
Thank you, Congresswoman Hayes. Certainly, that rule was about the agency following the eligibility guidelines that Congress sets in statute. And I think that's a terribly important conversation for all the reasons that you said. Child nutrition hasn't been reauthorized in 10 years, and I think it's a wonderful time to have that conversation. I think that Congress needs to be clear about what the eligibility requirements are. And the feds, the states, and the local providers need to make sure that those kids who are eligible are accessing these meals. And that's the concern about participation dropping in school meals, is we want to make sure that all kids want to participate in those meals. They are healthier than what most children are getting at home, and we want them participating in those. We also want to make sure that the program has integrity, so that it doesn't get beat down from those who don't support these, but that all Americans can support school meals and the great provisions that they have, that we get greater than 15% participation in the summer. So I support, it's been 10 years since Congress reauthorized these programs. I support them working in a bipartisan manner to be clear about what the eligibility guidelines are, and I'm sure that the agency will carry that out per your direction.
But I think you hit the nail on the head. The wonderful thing about Congress is that we do have a unique opportunity right now to reauthorize something that has not been reauthorized in 10 years. The needs of our country have changed. We are more aware of many of these issues, and we have a unique opportunity to do something about it. And that does not include throwing children off of SNAP. It does not include making sure that families don't have what they need. So I'm happy to hear you say that. And Mr. Wilson, I see your finger up, so you go ahead. You can have the remainder of my time.
Right. So when USDA withdrew the categorical eligibility regulation yesterday, there were celebrations across the country. We were no longer going to threaten these families that they would lose their SNAP eligibility and that their kids may not have access to free school meals. It was a victory that USDA pulled that back. I think there are many things we can do to try to deal with potential fraud, but let's be clear. Nobody wants fraud less than those of us who are fighting to make sure that people who are eligible for these programs get the programs. And so I don't want to have to mix the fraud discussion in with actual eligibility and how we can make sure that kids who are certified and eligible get school meals.
Sounds like we're all on the same page, and I'm so happy to hear that, because this is a conversation about making sure hungry kids are fed. Madam Chair, thank you so much for this hearing today, and with that, I yield back.
Thank you, Representative Hayes. I do not see Ms. Sparks or another Republican, so next we'll go to Representative Ledger Fernandez. You're recognized for 5 minutes for your questions.
Thank you, Madam Chair Bonamici, and thank you everyone on here for the work to make sure our children have access to the nutrition they need. I enjoyed the conversation about that this is about getting our children food, healthy food, and we should not be using excuses like far to others to prevent that. One of the things I'm very concerned about is the manner in which we've used lunch shaming to an unpaid meal debt to basically deprive children of the nutrition they need in school. In 2019, the School Nutrition Association reported that 75% of school districts had unpaid meal debt. And prior to the COVID-19 pandemic, there were regular news reports of lunch shaming practices, such as children having their meal thrown away or bills pinned to their shirts. Deputy Undersecretary Stacy Dean made a commitment in an earlier hearing to review USDA policies around lunch shaming to strengthen protections. And I am working on reintroducing the Anti-Lunch Shaming Act, which would prevent schools from singling out children because their parents or guardians have not paid their school meal bills. I want to know and get input on how we in Congress can work to end the root causes behind unpaid meal debt that leads to lunch shaming policies. Ms. Cooper, why is it important for Congress to address the issue of unpaid meal debt? And how would policies like increasing the 1.6 multiplier for the community eligibility provision, which Chair Bonamici mentioned, or eliminating the reduced price meal category help solve this problem?
Thank you for that question. In Chicago, as I've said, we are 100% CEP. So when we think about meal shaming and lunch debt, it's absolutely something that we do not support. And I think the committee can use this opportunity to really ban lunch shaming. It's something you should do. And then what we really do is we work with our staff in the school buildings, right? We work with the adults in the building to make sure that they understand our policies and how we are not using food as punishment, right? Food is fuel for our students. They need to be fed during the school day. And we really want to make sure that the debt is not something that you have to chase. So we support the increase for the multiplier to ensure school districts can get to this percentage so that they can become 100% CEP, and they don't have to worry about this. It's not, you want to take that off their plate, right? So that they don't have to, this is not something they have to worry about. We need to spend much more time focusing on access to students, finding menu items that they like, work with them throughout the day, work with our kitchen staff to make sure we're really using our energy on making the program better, more efficient, something that the kids enjoy, right? When they walk into the cafeteria, we want them to light up. We want this to be an exciting time for them. We want the dining experience to be exciting for them.
Thank you. And I like the way you went into what the meal should be so they get excited. And that leads me to my next question about what is culturally appropriate food and healthy food. My district is nearly 20% Native American. And right now tribes have to meet the meal requirements set out by the USDA, but the culturally appropriate food doesn't always correspond with USDA food patterns. This puts stress on our communities who want to serve the more culturally appropriate, which is sometimes more expensive, or local grown options, but are only reimbursed at the regular rate. Mr. Colicchio, as a chef, you undoubtedly understand the importance of food as a part of culture. Would you elaborate on why it would be important that children, like Native American children, have access to foods that are culturally relevant?
Sure, Congressman, thank you for the question. Just a couple episodes ago, we did a challenge with the First Nations foodstuffs in Portland, and it was really amazing to work with the tribe, creating just a beautiful meal out of the foods that we were provided. And this I think goes to if we had more scratch cooking in school. and the schools were actually staffed, and there were chefs that were from the community, and they would understand what the community's needs are, and they could provide those recipes, obviously all falling within the guidelines. But that's why I think we need to go back to scratch cooking, and we can't rely on food being shipped in and being, processed foods being shipped in from some, food company halfway across the country. This is exactly how you do this. Also, again, if those farmlands on native lands were able to, those farmers on native lands were able to actually provide food into the school lunch program locally, also you can make sure that there would be cultural appropriate food. Also, this is how you get the kids to eat more food. When they get culturally appropriate food, when they get food that they are familiar with, they eat more. And so these are all the reasons why we should see scratch food. Can I answer one question from before? I believe that the Free for All program, if it were implemented, would cost $5 billion. The CBO scored it. I believe Chairman Scott actually proposed this, and I believe the CBO scored it was $5 billion.
Thank you, Mr. Chairman, and thank you, Chair Bonamici, for your leeway and allowing him to finish his answer. I yield.
Of course, and thank you, Representative, for. I'm glad you brought up the lunch shaming issue. I was recently having a conversation with an adult here in Oregon who said her sister still remembers in elementary school running around the house trying to find pennies because she was supposed to bring money to school and the stress that caused. A really important issue. I do not see Representative Spartz or another member from the other side of the aisle, so I will next go to Mr. Mervan. Mr. Mervan, you're recognized for 5 minutes for your question.
Chairwoman Bonamici, I thank you very much. First and foremost, I want to thank all the participants. I want to add that my wife is a registered dietitian, and about 20 years ago, she worked for the Indiana Department of Education in the school lunch program. And so the vitality of education and health tied to food lunches are extremely important. Also in my district, Ms. Crystal Cooper, I'm in Northwest Indiana, the Hammond-Gary area. And so it's good to see a neighbor from Chicagoland and the challenges that we face together. In my district, we have rates of 90 to 95% free and reduced lunch program participation. And as a trustee who handled emergency assistance, I've seen the impact of food disparity and how it affects the educational system and how important this is to each and every family throughout my district in Northwest Indiana. And with that, according to the Centers for Disease Control and Prevention, U.S. diets are too high in added sugars and sodium, with 9 to 10 Americans aged 2 years and older consuming more than the recommended amount of sodium. Mr. Wilson, in your testimony, you mentioned the targeted market for unhealthy foods to certain communities. Can you discuss how poor nutrition and diet-related disease disproportionately impacts communities of color and how schools can help counteract these unhealthy environments?
Yeah, so this is a really complicated question, and it's got a complicated answer, but it's about how we live and work in a food system that includes advertisements targeted to children, targeted to certain communities. It has to do with the growth, the existence of food deserts and food swamps, so that kids have opportunities to get unhealthy food very easily, very readily, very cheaply, and don't have access to the healthy food and the healthy options either in a retail store or in other places, which is why school meals matter so much. We know that if kids are in school 5 days a week, getting school breakfast, getting school lunch, potentially getting after school snacks, we have an opportunity to help them eat healthy and to teach their palates. I love what Tom Colicchio said about having to try something 12 times before you get to like it. We have to teach their palates at a very early age about the different kind of opportunities that they can have and not just give them salt and sugar.
I thank you very much. Additionally, Black and Latino and other children of color have experienced disproportionate rates of food insecurity during the COVID-19 pandemic. An analysis of summer meal sites during the COVID-19 pandemic by research at Columbia, Harvard, and the University of North Carolina showed that meal sites were consistently located in areas that were more convenient for white families. Mr. Wilson, what can Congress do to ensure equitable access to nutritious meals for all children?
Right. So once again, it's a complicated question, but trying to bring equity to the food system. We're having a conversation of adding equity to the food system for the first time in decades. And you know, the great things that happened in the Healthy Hunger Free Kids Act of 2010 were helpful, but I'm hopeful that in 2021, as we move forward, we try to expand that access to equity. So I think there are all the things that we've talked about in terms of summer meals are helpful, but we also have to recognize that pandemic EBT in rural areas, in suburban areas, and in urban areas helps families be able to make choices and to spend their dollars and not depend only on the summer meal sites. We need to make sure that we have seamless summer options and that we're providing these around the course of the year. One of the challenges in summer is that, you know, depending on the free and reduced meal percentage in that community, they may not be able to provide free meals to kids under the current rules. We need to move to a, you know, school meals for all platform, because that will eliminate that and we'll have better options both for serving and for funding. And if I could, just for 1 second, touch on this question of meal debt. There are two losers in meal debt, and this affects urban schools more than others. The losers are school systems who have debts, 50,000, 100,000 or more. And we have kids who are being threatened to not be able to participate in school sports or school activities or even graduation because they've got a meal debt of $20 or $50 or $100. And that's a loser for schools and for students. We can't allow that to continue to happen.
Chairwoman, with that, I yield back my time.
Thank you very much, Representative Mervan. Now we're honored to have with us the chairman of the full committee, Congressman Bobby Scott. You're recognized for 5 minutes for your questions.
Thank you. Thank you, Madam Chair, and I appreciate this hearing. Let me start with Mr. Wilson, and we've heard a lot about increasing summer programs and after-school programs. Can you say a word about whether or not it's important to combine the summer and after-school meals with educational programming?
Absolutely. I mean, we already know that there is a summer learning gap that exists because kids are in school for 9 months and then in the summer they're not. And yay for summer vacation. But while we have this summer learning gap, we've also learned there's a summer nutrition gap because kids who have access to, you know, free school meals during the school year all of a sudden don't have the access. And we've already talked about the lower percentage of participation in summer meals programs. So we need to both marry the programming that helps deal with the learning gap with the food that deals with the nutrition gap, and also provide additional opportunities. You know, summer EBT is a great program and can help provide opportunities for families to be able to supplement it, in addition to changing the formula so that people who are in a marginally almost poor school district can also have access to free school meals.
Thank you. Mr. Lips, you had a list of very specific recommendations to increase summer nutrition. Could you remind us of that list? I think summer EBT was part of it.
Sure, Chairman Scott. I was talking about the importance of increasing because of the 15% uptake that we have in low-income children. But right now, the only option in most instances is for kids to come to a congregate site. Most of them don't have transportation. During the pandemic, we were able to test in a number of ways, a number of different interventions, including, as you know now, nationwide PEBT, a number of food banks, other providers, and some schools were running bus routes to deliver food, and certainly the Meals to You program that I talked about as well that was taking food directly to schools. So all of that with over 80,000 summer sites that were set up in the midst of the pandemic, even with the difficulty sometimes getting volunteers. So there are a lot of options out there, and I think letting the locals determine what is best for them within proper bounds that Congress sets will greatly help the intervention in the summer.
Thank you. Mrs. Cooper, we've heard that you have to virtually sabotage the nutrition standards in order to get a tasty meal that children will eat. Is that true?
No, that's not true. We have a very tasty, colorful, and fresh menu. We have a 28 menu day cycle. And the way that we develop our menu, right? We don't just put things on the menu. We work very closely with our registered dietitians. We actually work very closely with the students, and we do work with local chefs. So we make sure that the menu items are things that children want to eat. They are things that they need to eat. They are things that help them become, our future, right? So we want to make sure that students are eating, right? You hear things about kids not eating the food and throwing it away. We sample items before we put new items on the plate. So we have a lot of tools that we use to make sure the menu is absolutely what the students want to eat.
And when you do that, the plate waste is reduced?
So yes, our waste has not changed. So we were not always 100% CEP. We went to 100% CEP over the last few years. Our waste has not increased. We work very closely with our staff to look at inventory, to look at items they forecast. We're not, in the kitchens making a bunch of food just to throw it away. Again, we want the food to go into the kids' bellies, right? We want them to be nourished and fed throughout the day. So we do this for all of our meals: breakfast, lunch, after school meal, after school snacks. We work very hard to make sure that our students are actually consuming and enjoy the food.
And let me get, we heard an estimate of $5 billion to a year to go to total universal. That needs to be updated because it was during the pandemic when a lot of schools were closed. So we need to update that number. But when you went to CEP and everyone was eating, who didn't need to get a school lunch? I mean, it seems to me everybody needs a school lunch, so why shouldn't it be universal?
So it should be universal because it should be healthy meals for all, because all students throughout the day, we don't ask these questions about textbooks and math and things like that. This is food. This is a basic necessity that we as adults have a moral responsibility to ensure that all students are offered and provided healthy meals.
You mentioned school textbooks. We had to debate that in Virginia, whether or not students would get free textbooks. And I think we finally gotten there. So it's some things you don't think you have to debate that you actually do. Thank you, Madam Chair.
Thank you, Chairman Scott. I do not see any non-subcommittee members of the full committee here, so we will conclude the first round of questions, and then pursuant to our agreement, the chair and ranking member or ranking member's designee only may pursue a second round of questions. And I recognize myself for 5 minutes. And as I begin, I want to note that with the discussion that we're having about universal meals and the cost, I hope we can consider not only the cost savings to the schools from not having to do all the administrative paperwork, but the cost saving that we have from having healthy students with fewer healthcare problems as they grow and learn. So I want to ask Chef Colicchio, the Farm to School program. I want to talk about this because I've seen wonderful examples and visited schools where students were, pre-pandemic, choosing choices from a wonderful salad bar, all with ingredients produced by local farmers. They, as you know, provide grants to schools and early care and education sites, and they support local food procurement, farmers, school gardens, and nutrition. So it's a great program, nutrition education as well, which I know we've talked about today. So studies have shown that when kids get involved with growing or preparing the food, the more likely they are to eat it. So you talked about this a bit, Chef, but could you expand on your professional chef and a father? Why do you support the Farm to School program? What can we do to strengthen it? And also, what else can Congress and the Department of Agriculture do to support that food supply chain, which is so important in providing healthy, appetizing ingredients for school meals?
All right. Well, I mean, obviously, the Farm to School program enriches connections with the communities have with fresh and healthy food that's supplied by local food producers. It helps, changing purchasing habits in the school. And really provides that education around food as well. And this is why I think it's so important to take those local farmers and provide them with a market. I mean, we provide markets all around the world for corn farmers, soy farmers, we can take those farmers that are growing specialty crops, otherwise known as fruits and vegetables, and give them an opportunity to sell into the school lunch program, but really make it more robust. I also think we should bring those farmers into the school to teach those kids just about farming. But also, there's so many people, not just farmers. I want to give a shout out to my friends at Pilot Light in Chicago, who actually was an organization started by chefs that go into schools and they teach people about food and food education. They're working with the schools to actually create recipes. And so it's a combination of farmers and chefs, people who actually are producing food and producing wholesome food. You know, there's a lot being talked about the food system. Our food system works exactly as it's designed to. If you have money, it works for you. If you don't, you're left out. You know, in our country, calories are cheap, nutrition's expensive. I mean, anyone who goes and buys fresh produce will tell you it's expensive. And so programs like the Double Bucks program is so important because we can actually bend the cost of fruits and vegetables, make it more affordable for families that are struggling. Because actually, when families are actually given the choice, if they can afford it, they will make the better choices. But when you're struggling, you feed your family the cheapest foods possible. They're not the most nutritious, but they're cheap, and that's the Faustian bargain that so many families have to contend with right now. And so again, this is about education. This is about creating markets for farmers, and this is about including farmers in the conversation.
Thank you. It's really helpful. And this is the Education Committee, and we talked a lot about career and technical education. And I visited some high schools that have wonderful culinary programs. And again, an opportunity for students to really learn not only healthy cooking and eating, but also get on a career path. Chef Colicchio, again, thank you for talking about your mother, who is a school cafeteria worker. How can we better support the school for food service workers like your mom as we work on reauthorization of the child nutrition?
Yeah, my mom retired many years ago, and it was interesting because I tried to get her to retire well before her time. She was complaining about her legs hurting and her knees hurting, and it was a conversation that we had that really kind of rung a bell for me. She said she wasn't ready to give it up yet because she knew that these were the only meals that kids were getting, and so I think continuing education for the men and women who are working in our lunchroom. Providing additional culinary training so they can actually create more wholesome, nutritious menus, making sure they have fresh produce to work with. I mean, that's the one thing that she said, that she was concerned that when she leaves, that the fruits and vegetables would disappear. Mr. Lips, when he testified, he talked about that pear. I agree 100%. This is why we need to have a better educated working workers who are working in the lunchroom, so they know the difference between a rock hard pear and a perfectly ripe pear. When you don't know the difference, you put out whatever you have. And so this is really about education, continuing education for those cafeteria workers.
Thank you, Chef Colicchio. We have some great pears here in Oregon. They're especially good when they're ripe.
You certainly do.
So I yield back, and now I recognize the distinguished ranking member of the full committee for 5 minutes for your questions.
Thank you, Chairman Bonamici. Mr. Lips, program integrity is critically important in all programs. The Inspector General at USDA and GAO found some challenges related to improper payments in the school meal program previously. Can you tell us what the agency did to address some of these issues, and what do you recommend the Biden administration do to continue the good work of the previous administration?
Thank you, Ranking Member Fox. It is an issue that continually comes up in GAO and OIG reports and gives a negative reflection on a program that we all agree is a wonderful program. One of the things we did is work on redefining what a payment error actually is. And a lot of those instances, when they were putting a vegetable on a tray, but not the vegetable that they had planned to put on the tray, that becomes a payment error. And I don't think that's what any of us are thinking about when we're talking about payment integrity in the school meals program. And when we weed out those types of issues, it allows us to focus on the actual issues so that our federal regulators, our state regulators, and our local implementers are focused on the actual issue of delivering those meals. And there's an integrity team at the Food and Nutrition Service that works constantly on that, working with states to help make that happen. And I think has made a lot of progress on that in the past.
Great, thank you very much. There were also program integrity concerns related to the summer food program waivers. Could you briefly tell us what those were and how they were addressed? Also tell us any lingering program integrity issues you believe need to be addressed.
Sure. The Ops Inspector General at USDA identified a number of concerns in the summer food service program under its current operations, and that ran from claiming and counting to whether food was kept at a correct temperature. There were a lot of concerns across the board on that. And the team worked and continues to work to address those across the board. Obviously, in a program as diffuse as summer, obviously, I talked about during the pandemic, there were 80,000 sites set up. There are a lot of local officials involved in that. It's a difficult chain to follow, but an important one. But also, when you look at the temperature of foods, those are extremely critical matters. And so just a lot of focus. They talked about making sure that the folks running the programs have the education and resources they need. To keep up with those type of issues is very important. And we need to make sure that both in the policy of child nutrition and in regulations that we're focused on giving the tools to those local individuals to be able to move forward in what they need on that front. One of the reasons I believe that when you talk about making sure we know which kids we're serving and how many kids we're serving, one of the questions I got so many times, and thank you to all of the members of Congress for the flexibilities that were so quickly given during the pandemic to make sure that children who were furloughed from school had access to food. But one of the questions I continue to get is how are we providing programs through so many options and we still have so many kids that are not getting fed? And sometimes we open up the spigots across all of these programs, and some of the folks forget to focus on those most in need and make sure that they're being taken care of. And so it's really about the types of individuals at the table with me today, making sure that they are concerned about their local population and making sure that those most in need are getting taken care of, particularly with something basic as nutrition.
In your written testimony, you talked about a visit to a school where the kids wouldn't eat the food despite it being prepared by a chef. Can you discuss why this visit stood out to you and what it tells you about the need for flexibility in the regulations and the importance of understanding the kids we're trying to feed?
Sure, Ranking Member Fox. I mentioned this a little bit earlier about the black beans, but I'll tell you that the meal was good. The chef did not fail in preparing a good meal. It was good, but he prepared black beans with tomatoes cut up in them, and the children told me that they had neither tried black beans before, nor were they familiar with what the tomatoes were cut up in there, and so it just looked like a foreign food to them. That they were not interested in trying. And the staff that day didn't have the time and resources to help educate them on that. And it takes all of that to make that happen. It's obviously a big focus on education through things like Farm to School that can change that.
Great, thanks. Ms. Cooper, I understand your menus meet the sodium target 2 requirements. Do those menus meet target 3, which is right around the corner, without any flexibility?
So no, they don't meet target 3 right now.
Okay, well, I was going to ask you, would you submit your proposed menus that are target 3 compliant? We'd like to see what those are so we can share them with other schools. If you get compliant with target 3, we'd like to know that.
Yes, I will do. We will do that. Thank you.
Great, thank you very much.
Do you yield back?
Yes,
Thank you, Ranking Member Fox. So this concludes round 2, and I want to remind my colleagues that pursuant to committee practice, materials for submission to the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing. So by close of business on June 24th, preferably in Microsoft Word format, the materials submitted must address the subject matter of the hearing. Only a member of the subcommittee or an invited witness may submit materials for inclusion in the hearing record. Documents are limited to 50 pages each. Documents longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within the required time frame, but please recognize that in the future, that link may no longer work. And pursuant to House rules and regulations, items for the record should be submitted to the clerk electronically by emailing submissions to edandlabor.hearings@mail.house.gov. Again, I want to thank the witnesses for their participation today. Members of the subcommittee may have additional questions for you. We ask the Witnesses to please respond to those questions in writing. The hearing record will remain open for 14 days to receive those responses. And I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. Now, I recognize the distinguished ranking member for a closing statement.
Thank you again, Chairwoman Bonamici, and thanks to the witnesses for joining us today. I think this hearing has helped us see that everyone wants to help provide healthy meals to students. That is certainly a good place to start for any reauthorization. But I also think we've learned that while we can be aspirational in our goals for the meals, we also have to be realistic. We have to think of all schools and areas, not just look at well-resourced or large schools that have the staff to address the complexities in the program. We also have to think about how we help schools get students ready to actually eat the healthier food. Please let me be clear here. That doesn't mean no standards. It means having realistic standards that help us accomplish the intended goal. It's great to hear about pockets of success and scenarios where new meals worked. I think we can certainly look at that, but we have to remember that we legislate for all schools, which is a major problem from my perspective when we dictate from Washington, D.C., and not just those with access to world-class chefs. We also need to think about how we can reform the programs to work and find the success the chefs have found. One thing I'm disappointed in about the discussion from our hearings today is the lack of conversation about parental engagement. Parents are a critical component in all of what we do for children, and we need to look at reforms that help them provide healthy food for their children, help them teach their children to choose healthier options. I think we also need to look at why so many students are walking away from the meals, and it's increasing. And even where there are free meals, they're walking away from them. If we do work on the reauthorization of the school meal program this year, I hope there'll be a robust conversation about reforms to the programs to help parents tackle healthy eating and not just rely on the schools to do it all. Finally, we didn't talk a lot about it today, but I'll flag that any reauthorization must work on making the program easier to operate. That means from compliance with the regulations to monitoring costs. I go into every cafeteria I possibly can go into when I'm visiting schools throughout the district. And what I hear from the quote school lunch ladies, which is what most people still call them, and it's not a pejorative, it's a loving term, I think, is that they are very concerned about the paperwork and about how they desperately want the children to eat the meals they prepare, but how difficult it is to meet the requirements. We have to look at compliance, regulations, monitoring. Accountability is critical, and we must look at how to ensure we're focusing the federal and state efforts on the schools that need to improve and not just looking at checking boxes. Thank you again, Madam Chairwoman, for the hearing, and I thank the witnesses for their time and information, and I yield back.
Thank you, Ranking Member Fox, and I now recognize myself for purposes of making a closing statement. I want to thank our witnesses again for taking the time to share their expertise with the committee today. Your compelling testimony made clear that the pandemic has exacerbated a child hunger crisis that existed long before COVID-19. Across the country, families are struggling to put enough food on the table, and children are growing up without the nutrition that's critical for their health and development. As we discussed, the committee acted quickly to address this crisis in the wake of the pandemic. Our early investments in child nutrition programs prevented millions of children from going hungry. This is significant progress, but our responsibility to feed hungry children extends beyond COVID-19. As I said at the beginning of the hearing, no child in this country should go hungry regardless of whether or not we're facing a devastating pandemic. And I want to note, in response to the ranking member, we did actually talk about the administrative burden, and we addressed a couple of ways to address that. More community eligibility or meals for all that addresses as you described, the paperwork and bureaucracy that the people working in food services are talking about. We must enact the American Jobs Plan, the American Families Plan, and a comprehensive reauthorization of child nutrition programs. During this turning point in our recovery from the pandemic, these proposals would invest in nutrition programs, in schools, in kitchens, in communities, to help eradicate child hunger throughout the country. I look forward to working with my colleagues on both sides of the aisle to take these critical steps toward providing all children with the nutritious food they need to lead healthy and fulfilling lives. Thank you again to all of you for participating. If there is no further business, without objection, the subcommittee stands adjourned.